Hi, Subrat here again, the physical therapist, and I am also a chronic pain expert. So we are going to continue probably the last video about the headache. I already had two videos. The description should be in the link, or you can look for my first couple of videos where I talk about what is headache and what happens, how that happens. Not every headache is created equal. And also on my other videos, I talk about how headache, a very few percentage, maybe 1 to 2% of the time, you have some underlying condition, like you have diabetes, you have high blood pressure, or some infection going in your brain. Those are serious. You need to check it out. But those are kind of rare. So the most one, which comprise of all the other headaches, it is the musculoskeletal headache. And also a portion can be a vascular, which we call as a migraine. So now, today, we are going to talk about the treatment, what you are going to do about it. Here, we treat so many patients, and headache is just one symptom. And I have other videos that, in nature, or any kind of symptom does not come alone. Yes, you might be complaining right now because your headache is bothering you. There might be other things going on with it. It could be jaw pain. You might feel like you're having a toothache. You might have neck pain, but headache is bad, so that's why you are complaining right now. If your headache kind of goes down, then you are going to complain of neck pain because we think our body is in pieces. So, when the majority of the people, they suffer with musculoskeletal headache, the first thing that goes to most of the people's mind, yes, I'm going to go to the physician and I'm going to take medication. Well, medication is actually extremely useful, but unfortunately, it is only useful only 2 to 3% of the time, when that is a real problem. Like for example, I'm not saying your headache is not real, but what I'm saying like that, if you have an infection, or if you have a sinus infection, or you have like your blood pressure is off, your thyroid is off, those are actually real medical condition which can be tested and found through blood test or some kind of x-ray. So when you get medicine for that, you will be better. But in a musculoskeletal condition, there's a lot more going on. And that cannot be taken care of by medication. In fact, many of this medication is going to create more problem. Like if you are taking Botox injection. Of course, there is side effect of Botox, but it actually never ever treats the cause of the pain. So the number one reason you are having the musculoskeletal headache, that has to be identified. So if you can find a physical therapist who really in your area and who is an expert treating, actually many of the therapists I know, they are very much know what to do with in case of a musculoskeletal headache, because there's a lot of going on. As I told you, it is a problem of the upper quadrant. So the headache is just one symptom. So you might have other issues too. You might have neck pain, you might have shoulder pain, but you don't relate all that. But those are the things, are mechanical things. So you cannot take care of that taking some medication. So if you're taking medication, of course it can cover it up to certain extent, to certain limit. But then things are not going to stop changing. So it is going to continue to change. So if you have a headache and you suffered with it for 5, 10, 20 years, the headache might go down in intensity. The next thing is going to happen is your neck pain. So if you are trying to chase the pain, you have headache, you are taking care of it. Now you have neck pain, now you are taking care of it. So you are chasing the pain rest of your life as your body is getting into kind of a more and more distress and more problem is going to happen. But here, if you remember me, or if you listen to my video all the time, I talk about you need to take care of your body as a whole. You cannot really do all that and get into more and more trouble. So the number one, what I say today, the medication is not going to take care of your problem if it's a musculoskeletal headache. and which is most of the time that is. So if you find a good physical therapist who is expert treating this condition, they will find out all these issues and they can treat you extremely systematically, and that's exactly what is required. So that is one part, because your body has changed, it has to change it backward. So if a physical therapist can identify all these problems and they can take care of it, change you backward, not only your headache will be gone, the many other problems which is yet to come, that can be resolved too. That is the most important thing. But what else you can do on your own? So in your headache, if you remember, there could be many triggers are there, and you'll be surprised to know number one trigger is the stress. So how you feel. So your headache will be fine. You suddenly get a phone call, stressful, and your headache goes through the roof. How you feel. Again, I have a headache I already have a video about the stressors and stress, but the stress is the number one thing. You can do many things to reduce your stress, starting from walking to doing meditation, yoga, mindfulness. There are many things you can do to reduce your stress. Listening to the music, enjoying nature, playing with the dog. So you have to reduce your stress. Without dealing with this stress, your headache is not going to go away. So that is one trigger. The second trigger, any kind of food, you have a trigger. Some people have trigger about chocolate. Some people have a trigger about some kind of food. Like for example, my wife, she rarely have headaches now, but sometimes she do have a headache, and it triggered by MSG. So that's what you probably want to eliminate. Any kind of added thing to your food, including MSG. So we love eating Chinese. So when I go to Chinese restaurant, I say, hey, just prepare your food with no MSG. And that works for us. So these are the triggers you have to identify. And, those things are not good in any way in the first place. So if you can stop kind of using any kind of added thing to your product or your packaged food, or any kind of chemical is out there, if you eliminate, that can be helpful. Like some kind of perfume can trigger too. So those are the things. You make a note, take a notebook and see what really trigger. You have to eliminate all those trigger. Okay? So what did I tell you? Like you need to be evaluated and treated by a therapist who is expert treating your headache condition, and that's the only way, because a mechanical issue can be treated mechanically. Second thing, you have to reduce your weight, reduce your stress. And the third thing is that you have to use or stop all the triggers. And the last but not the least, you need to learn how to breathe. So I have a video about breathing exercises. If you watch it, you probably have practices. If you do these simple breathing exercises, it can be advanced. If you are doing yoga, they will teach you some breathing exercises too, but those can be a little bit advanced or intense. But you can do simple breathing exercises morning or evening. If you cannot do in the evening, it's okay to do it in the morning. Okay, so you can do those breathing exercises. So if you do it regularly, that really helps tremendously with your headache. So even if you have a headache, despite of doing everything, you can do breathing exercises. You will see your headache is going to calm down. Because when you do breathing, that actually stimulates your parasympathetic system, and it kind of brings down your sympathetic system. So those are all the autonomic nervous system. So when you are firing up your parasympathetic system, that actually relaxes you, and also it can take care of your headache. So, and last but not the least is the water. Drink water in the morning and also throughout the day. So if you drink few cups of coffee, caffeine here and there, that's okay, but avoid soda. Soda can be a big trigger for your headache. So drink water, plenty of it. Once you get dehydrated, also can trigger any kind of headache. So These are simple things. If you need more information, you can always message us. We are here to help. Try to share this video to friends and family. As far as I know, 8 times women, they suffer with headache. We see this every single day. If somebody would have this information, they probably steer themselves in the right direction rather than going and doing all this mindless treatment, especially taking Botox or any of those things that can really hurt you in long run. So you want to bring yourself back to health. So if you like this video, please share, or you can press like. And I'm going to see you next time with another episode of another video and about another condition. Thank you so much for watching. Bye.